So, tarsal coalition, as the name depicts, is when two or more tarsal bones are coalesced or joined together. This is a case of failure of differentiation. The commonest is calcaneo-navicular coalition, and the second common is talocalcaneal coalition. The calcaneo-navicular coalition happens in the age 8 to 12, while the talocalcaneal coalition happens in 12 to 16. The patient will come up with a flat foot deformity, which will be not improving with a heel raise test and will be resistant. The coalition can be fibrous, cartilaginous, or bony. Regarding assessment of these patients can come with a recurrent ankle sprains, and a high degree of suspicion is important. Talocalcaneal coalition can be bilateral as well in 50% of the cases. In calcaneo-navicular coalition, when I do an X-ray, there is an anterior nose sign or anteater sign, and I will do a 45-degree oblique view, which will confirm the elongation of anterior calcaneal process. The pain in calcaneo-navicular coalition is lateral. Talocalcaneal coalition on X-ray will show a talar beak or C sign, and the pain is mostly medial. I can do a CT scan which diagnoses the coalition, and MRI if there is a fibrous or cartilaginous coalition. Regarding treatment, a non-operative treatment like stretching, heel raise, and immobilize with a cast should be advised in the beginning. If still there is a resistance and the patient's symptoms permit, we can do an operative intervention. For the calcaneo-navicular coalition, the approach is lateral, while the talocalcaneal coalition, the approach is medial. In talocalcaneal coalition, I can take the flexor hallucis longus tendon and interpose it in between. For the calcaneo-navicular coalition, I can take extensorium brevis and interpose it between. I can also use bone wax as well. If the talocalcaneal coalition involves less than 50% joint, resection is advisable. If more than 50%, subtalar arthrodesis is one option. Triple arthrodesis is advised if the talocalcaneal coalition is involving more than 50% of the joints, or there is failed resection with persistence of pain.